So today, we're going to dive into one of the simplest yet most powerful medical innovations of the 20th century. Seriously, it's a treatment for a super common childhood illness that's so effective it has completely changed the game for pediatric care and, believe it or not, saved millions of lives. Okay, let's start with a number, a really big one, over 1 million. According to the World Health Organization and UNICEF, that's roughly how many lives have been saved every single year since the 1970s, all thanks to a simple solution called oral rehydration therapy. That is an absolutely incredible statistic. So let's unpack the problem it was designed to solve.
For any parent or caregiver, a kid with vomiting or diarrhea is a huge worry. And the real danger isn't the bug itself, it's the dehydration that can happen so fast. Losing all those fluids and essential salts can become serious really quickly. So step one is knowing what to look for.
Right. So how do you tell the difference between a child who's just feeling a little crummy and one who's actually becoming dangerously dehydrated? Well, it turns out clinicians have a very clear, structured way of figuring this out.
Here's how they do it. Doctors and nurses use a scoring system based on these key signs. They look at a child's overall appearance. Are they just thirsty or are they getting drowsy and limp? They check their eyes. Are they getting sunken? And a big one, are there tears when they cry? Is their mouth just a little sticky or is it totally dry? Each one of these signs helps build a clear picture of just how severe the dehydration is.
So once dehydration is identified, we get to the hero of our story. The recommended first-line treatment isn't some high-tech machine or complicated drug. It's something remarkably simple, oral rehydration therapy, or what everyone calls ORT. Simply put, ORT is just a special, perfectly balanced solution of sugars and salts. And the magic is in that specific combination. It actually helps the body absorb fluids and electrolytes way more efficiently than plain water ever could. And the benefits are just so obvious. It's incredibly effective, totally safe, super convenient, and, this is a big one, really, really inexpensive. And when you put it side by side with the alternative, you really see why it's the top choice. ORT is non-invasive. It's easy. And get this, it has a failure rate of less than 5%. Now, on the other hand, you have IV therapy. It is absolutely vital for severe cases, but it's invasive, it requires a needle, it means a hospital stay, and it's a lot more expensive. The goal is always to avoid that if you possibly can. But here's the crazy part. This quote from an Oregon Health and Science University clinical document points out that even in developed countries, with all our resources, ORT is often underutilized. It seems like sometimes we're just too quick to jump to the high-tech IV solution before giving this simple, effective therapy a real shot. So to fight that tendency, hospitals create these really clear, evidence-based plans. We're going to walk through what's called a clinical pathway. It's basically the step-by-step playbook for how medical teams are supposed to treat pediatric dehydration. It all starts the second a child arrives. A nurse does a physical assessment, checking for those exact signs we just talked about. Their general appearance, skin turgor, that's how fast their skin snaps back when you pinch it, those sunken eyes, and whether or not there are tears. They're basically gathering all the data to figure out the level of dehydration. And if the diagnosis is moderate dehydration, the goal is written right into the pathway, and it's crystal clear. It's not just to try ORT, it's to begin it aggressively. The entire focus is on rehydrating that child with this simple approach to prevent the need for an IV and maybe even a hospital stay. Okay, so how do they actually do it? Well, it's not about just handing a kid a big cup and telling them to drink up. No, it's a very specific, very methodical process. Now, the official protocol might look a little complicated here, but the logic behind it is actually incredibly simple. It all comes down to one thing. The amount of fluid is tailored specifically to the child's weight. Smaller kids get smaller amounts, bigger kids get more. It's all about precision.
And here is that protocol broken down. This is the famous small, frequent sips method. You start with a tiny amount, just 5 or 10 milliliters. That's like 1 or 2 teaspoons, often given with a syringe or a spoon. Then you wait 5 minutes. If the child keeps it down, you repeat. Now, if they vomit, you don't give up. You just pause for about 20 minutes to let their stomach settle, and then you start that whole cycle over again. Patience is absolutely key here. This whole methodical approach leads to a very clear fork in the road in that clinical pathway. The treatment is either working or it's time to think about the next step. And it all boils down to this one simple but critical question. Is the child actually able to tolerate the oral rehydration solution? The answer to that question determines everything that happens next.
If the answer is yes, that's fantastic news. It means the ORT is working. So the protocol says to continue, maybe even double the amount of fluid, and then check back on the child in about an hour to make sure they're still improving.
But if the answer is no, there's still a clear plan. The team doesn't just immediately jump to an IV. They'll often try giving some anti-nausea medication and give the ORT one more go after another short break. It's only if that fails that they'll start IV fluids. It's a really measured, patient-first approach.
And when this simple cycle of sips works, which it usually does, it leads directly to the goal of this entire process, sending a rehydrated, healthy kid back home. The official checklist for going home is really straightforward. Can the child keep fluids down? Yep. Are their vital signs stable? Check. And just as important, are their parents confident that they can keep giving fluids at home? When all those boxes are ticked, the mission is accomplished.
So the takeaway here is so clear. A really simple, structured approach using ORT can effectively treat most cases of pediatric dehydration. It reduces the need for more invasive, more costly interventions. It's a perfect example of low-tech, high-impact medicine.
And that kind of leaves us with a final question to think about. In our world of high-tech, cutting-edge medicine, what other simple, powerful, and brilliantly effective solutions like oral rehydration therapy might we be overlooking? What other huge problems could be solved with nothing more than the power of a sip?